Hello, everyone. This is Mark Anthony with AI Edge Promotions, or podcast. Same thing. We're here to bring you the best of the best doctors in their area and in their niches. Today, we have a doctor that is currently with us, Dr. Rowe, and you can find Dr. Rowe in AnnaNeurodoc.com. I love that. AnnaNeurodoc.com. It's ANEURODOC.com. And today we're going to be talking about something very interesting. Yes, neuropathy, and I'm sure we have family members that are struggling with neuropathy, but we're going to talk about how to identify neuropathy in its early stages, how to identify it, and while we identify it, how can we best find the best treatments, the best outcomes to help you not get to that place where you have full-on neuropathy. Because there are certain times where you can start getting early cases, but what happens is people ignore it, and then they're in the hospital, and then we have amputation. So our whole thing is to get you not into the amputation mode, but get you over here to where you can have people like Dr. Rowe help you. So we're excited today to have you, Dr. Cameron Rowe here, DC. And before I give you the ball, I want to let you guys know a little bit about Dr. Rowe. I'm pretty excited about. See, there's a lot of doctors that are just regular docs. They're chiropractors. That's it. They crack backs and they're done. Not with Dr. Rowe. Dr. Rowe takes extensive classes and certification and training. Dr. Rowe, he received a masterclass certification training. And what does that mean? What does that mean? Well, great question. That means, working with, doctors for alternative treatments for neuropathy, and that's ongoing. Dr. Rowe also received the prestigious Neuropathy Treatment Award. I mean, what is that? You don't just get that type of award out of a Cracker Jack box. We're talking hours and hours, spending time with international neuropathy associates to identify neuropathy treatments, not just to identify, but how can we find the problem and not just patch it. The problem is we have so many doctors out there that want to just give you pills. And guess what happens when the pills wear off? That's right. The breathing stops. So that's why we have doctors like this. Thank you so much, doctor. I hope that was a big softball throw.
Absolutely. Thank you very much. And thank you for inviting me on the show today.
Yeah, thank you. So let's talk about that. How to identify neuropathy in its early stages and what we can do to prevent that.
Okay. So the first thing that we start with is a very thorough history, a history of what's going on, what other medical conditions that the patient has, what medications or past medications that they've been taking for that, because that'll give you a good clue about whether or not someone could be a risk for developing early onset neuropathy. Mm-hmm. So the first key component is that history. And then we do a thorough evaluation of sensory testing. Sensory testing, we're going to check light touch, we're going to check temperature sensation, we're going to check vibration, painful stimuli, and we're going to check all the reflexes to make sure all the reflexes are intact and normal. Typically, when neuropathy starts, it starts down in the feet. So you'll tend to start to see a little bit of a decrease in the Achilles tendon reflex. Your sensory changes as far as to temperature, hot, cold. You may feel it really good up on your forehead, but you may not feel it at all down in your feet, or to a much less degree. So those are all, that's called the Toronto Clinical Scoring System. It's actually a objective test that we use here in the office that is not painful to identify patients that have different stages of neuropathy.
Oh, wow. So what are some of the things that you've seen that maybe you've noticed that you've helped people where they were about to get into that stage of neuropathy? They're not right into neuropathy yet, but they're about to get in that stage. What are some of the things that you've done to help maybe kind of keep that stage back so it gets out of neuropathy mode?
Great question. A lot of it starts with nutrition. You got to cut out all of the excess sugar in the diet. Most patients, a vast majority of patients that have neuropathy either have hyperglycemia, prediabetes, or they're diabetic. So by getting that A1C down to a lower level, you're going to see a better response altogether. So cleaning up the diet, making sure we got lots of meat, vegetables, and a little bit of fruit. and getting out of all that processed foods, getting away from the diet sodas, getting away from the sodas in general, increasing water helps tremendously. And then as far as the actual in-office treatment, we use what's called electroanalgesia. Most patients, they know what a TENS unit is, and a TENS unit is great for pain, but it only goes up to about 250 pulses per second, where the electroanalgesia goes up to 10,000 pulses per second, and you get a lot of vasopneumatic or blood vessel expansion. Combating neuropathy is all about getting blood flow into the extremities. That is what's going to bring water, oxygen, nutrients to those nerves to keep them from continuing to just wither away.
So are these treatments that you currently do in your office now, like how would that look like? So you find somebody that's maybe about to get neuropathy. Do they spend what 5-10 minutes with you, and then you do how does that work? What type of exam, and then what are the steps that you normally
So
kind of?
typically the first visit, I spend about an hour with a patient doing a full consult and evaluation. And then the treatment, the electrical component of it is 20 to 25 minutes. And then we utilize a lot of infrared light therapy or laser therapy here in the office. Those all are designed to increase blood flow to the extremities. We give patients supplements to take home. A big supplement that is very important in neuropathy, especially diabetic neuropathy, is alpha lipoic acid, is an antioxidant that's found in green leafy vegetables, meat, fruit, and you need that in order to combat the continuous degenerative changes that happens to the nerves. So we put on our patients on anywhere from 8 to 1600 milligrams of alpha lipoic acid, just depending on what stage
Right.
they're in.
Okay, that makes a lot of sense. So you spend about an hour with them, and then is there like, do they have to come see you is that once a week? Is that normally once a month, or how does that normally work as in type of treatment?
Great question. We have two different treatment approaches. We have a home-based treatment approach and we have an in-office based treatment approach. If you do the home-based, which I prefer, because once a patient has neuropathy, they're always going to have neuropathy. And depending on the severity, if it's stage 2 or above, I really like them to take the equipment home and treat twice a day at home instead of coming to my office 3 times a week for an hour.
Interesting. What type of equipment is this? Is this like a stimulus? Is it kind of like a
So
shock wave, or is it what? I'm kind of curious.
So we have Shockwave, which we utilize in office, and then we have the matrix therapy by Neuromed, which is the company that produces the electroanalgesia, and it
Hmm.
has vasopneumatic component to it. So there's actually suction, sucking fresh blood into the feet or into the hands if you're treating the hands. If that's the in-office care, the out-of-office care, we utilize a device called a rebuilder, and the
Hmm.
rebuilder was developed by a very intelligent PhD medical doctor that noticed that our nervous system controls our body on a frequency of 7.83 hertz. And he actually designed a waveform in this device, and it's patented, and it actually reverses the effects of that. You actually, when you have neuropathy, think of your nerves like they're scrambled. They're staticky. They're not getting good sensory information because that coating around the nerve has degenerated away. So with the rebuilder, we can actually send those electrical impulses at the right frequency to bring those nerves back on to track and back in line and to help improve the overall sensory and blood flow to the feet,
Oh,
hands.
well. Okay, that makes a lot of sense. So, do you have any of those units on you? Like, I'm kind of curious with what the way those units look like. Do you have any in your office currently right now, or are they all shopped out to everybody?
No, there's one in, I have one here that I use for demonstration purposes.
All right, doctor. So you have the rebuilder. Let's see what that looks like, and maybe give us a
Okay.
little tour of that, how that works, and how you use it in your office.
All right. So this is the rebuilder. This is for demonstration purposes in my office. It's also part of the physical evaluation, but there's little plugs right here at the top where a wire lead that connects to a rubber pad goes down into a bucket of water that you will have your feet placed in with the water over the top of your feet. So that way you're getting full sensation, full coverage on the whole foot, as opposed to just a little square where like a TENS pad would use. And there's two ports. You would turn them both on, and what that does is it'll create the electrical current going back and forth between the legs and the feet. So you're treating the whole nerve track from the foot all the way up to the lumbar spine down to the other foot with that 7.83. But it's very simple to use. You just turn it on. Okay. I didn't have it all the way plugged in. There we
Oh,
go. You can see the little green light flashing there. There's a mode selector right up here that will tell you whether you're using 7.83 hertz, EMS, or muscle stimulation, or TENS therapy. For neuropathy, we're going to use the 7.83, and we're going to turn both of them on just to where you lightly feel that sensation. You don't have to turn it up. It doesn't have to be painful. It doesn't have to be uncomfortable.
okay, awesome. And so how long do they use that for? Like 15, 20 minutes?
This will run for 30 minutes and then it'll shut off automatically. Treatment's over at that point. In cases of severe neuropathy, I would have the patient do that twice a day.
Okay. And then does insurance cover that?
Some insurances will cover the cost of the unit. Some insurances will not. I've seen it both ways. So if the insurance doesn't cover it, then we work with the patient financially to make sure that they have one of these to take home if that's what they want to do.
Wow. And when you see people using this, do you see, I mean, what are the results normally like?
I've had patients come in with very severe neuropathy, meaning they've lost 90 to 95% of the sensation in their leg or their foot. And I've seen as much as an 80% improvement with it. So those are patients that are dedicated, that are doing every step of the therapy all the way through. And they do it for about 3 to 6 months.
Okay, awesome. So they see a huge, I mean, a drastic drop
Drastic.
as getting better, which is good.
Mhm.
Awesome. And then so that's one of the units. And do you have like an in-house unit too, or is that just kind of just more
I
like
do have an
that?
in-house unit. It's in a different room,
Oh no,
but
it's fine. We don't have to
I can certainly go back. I can pick up my laptop and take it and go show you the unit and what it looks like.
go for
If
it,
you,
man.
all right, here we go. I'm
Pick her
gonna
up. Yeah.
give you. I'm in my treatment room right now, so we're gonna go back to the therapy area. I'm gonna bring you right over here. I'm gonna turn the boards there. That is the matrix therapy right there.
Oh,
There's
nice.
these suction hoses that connect to each one of these ports, and this is the electrical component. There's a computer processor in here that allows this unit to go from 0.1 pulses per second to 10,000 pulses per second,
Oh,
and it
wow.
can change on the fly. This part down here is the vasopneumatic device, where it's actually there's a vacuum component to it. So when I turn that machine on, some cart, when I turn that machine on, this will actually pull negative pressure, so it's sucking the blood into the extremities. And there's specialized hoses that we use to that. So for example, we would put one of those suction cups on each side of the calf and then one on the bottom of the foot to utilize that therapy. Or we
Right.
can go from the knee down. It just depends on how far up the patient's having symptoms.
Okay. Well, that's a nice looking machine right there.
Absolutely.
Awesome. And so you've been working with neuropathy for about how long?
It would be 9 years now.
Have you noticed neuropathy cases going mostly up, or you noticed that they're kind of going down? What do you, as in just
As in,
worldwide? I would think it would be up because of the food. We haven't got the
yeah,
food down.
yeah, it's increased drastically because you have not only the diabetic part of it, you have chemotherapy induced peripheral neuropathy. So as more patients are dealing with cancers that are caused by the excess sugars and the diets that we have, the drugs that they use to treat the cancer a lot of times will cause chemotherapy induced peripheral neuropathy. You have also patients with post-COVID syndrome that have systemic polyneuropathy. I've seen several of those since the COVID epidemic. And then, of course, you have the idiopathic neuropathy, which means we don't have an organic cause of the neuropathy. We don't know why it's happening. It's not due to a medication. It's not due to chemotherapy. It's not due to COVID. It's not due to diabetes. So it must be one of those unknown cases.
Okay. Wow. That's awesome. So are you seeing that these smaller units are these the smaller units that you normally give to people that are about to go into neuropathy where they're kind of like on the verge of going into neuropathy or not? Or are those more for the advanced people that have had?
You can use it for someone in stage 1 or stage 4. Of course, stage 1 is going to require a lot less treatment than someone that is stage 4. It's going to be months of treatment before they start to have sustained improvement between treatments. So
Right.
rebuilding that neurological connection, the more damage that coating and lining around the nerve is, the longer it takes to get that better.
What are some of the symptoms that people that you notice that come to you in your office that tell you that ask you, these are some of the symptoms that I'm getting that are like pretty irregular?
Great question. Pain in the feet for no other reason, doesn't matter what pair of shoes you wear, that would be a symptom of it. And it's usually bilateral, both sides, and it's equal. It's not worse on one side. Like if you have a pinched nerve, you may have pain on the right, but not on the left. With neuropathy, it's usually bilateral and symmetrical. You also see pins and needles, burning, sensitivity, increased sensitivity, like to light touch, putting a pair of socks on, the blanket or the sheet touching your feet at night. Those are typically going to be your initial symptoms. It's usually more of a painful stimuli. And then as the condition progresses with time, then you start to have more of the numbness. You can start out with having numbness. It's just not as frequent as starting with pain. But the numbness, patients tell me, oh, I feel like I'm walking on balloons. I can't feel my feet at all. I can feel the pressure of my foot touching the floor, but I can't feel the carpet. I can't feel the tile. I can't feel the cold on the floor. Those are telltale signs.
Oh wow. Yeah. So have you ever heard of one maybe like that just kind of, wow, I've never heard that one before. Like because you've been doing this a long time. Like something that you're like, well, I've never heard that one before. You have any of those aha moments where you're like, wow.
Yes, the one thing that's really, really good, I'm glad you asked this question. Itching, chronic itching that cannot be explained. There's nothing wrong with the skin. There's no
Really?
eczema, no psoriasis, but there's itching that takes place. And that is a sign of neuropathy.
That's a new one. I've never heard of that one.
That one took me a while to figure out, with that particular patient. I've had two of those, and it did take some time to figure out that, okay, we're dealing with a neuropathy, not from, some kind of skin condition or allergy or something of that nature.
Oh well. So back to that machine. Is that also a good machine for people that are already going through the process where they maybe have like like how sometimes they'll start off with a sore in the bottom of their foot and it's not healing?
Yes, the matrix therapy, when you talk about patients with like diabetic ulcers, there's
Right.
there's actually published studies where patients that were otherwise going to have an amputation have resolved that condition by utilizing the matrix therapy with the electroanalgesia and the vasonomatic therapy.
It starts to heal that area.
Yes, sir.
Wow.
Absolutely.
And so okay, here's another one. Do you only rent to the people in your area? How does that work?
No, actually, I've had several patients that, maybe a parent, elderly parent lives in Florida or something like that. Yes, they have to, while they're here, I've got to see them, evaluate them, examine them, but I can treat them from afar. And that's utilized. Of course, the out-of-pocket expense is a little bit more with that because you're purchasing the equipment to take home, but it's a highly successful treatment, and it keeps them from going down to that amputation kind of
Yeah.
phase.
Okay, wow. That's awesome. Well, doctor, we actually hit on some really good things today and things that I really didn't know we were going to be talking about, which is also
Uh,
great. Sometimes
so
go with the flow. Thanks for the short tour of your office and showing a
you're
couple
welcome.
of these units on what you do. And I love your passion on how you're helping people take their
Thank you.
body to the next level, to heal their body, to they don't have to live in this, I call it this fear monger.
Absolutely. I just, one of my really good friends is an orthopedic foot and ankle surgeon. And when we sit down and we talk about neuropathy, he's like, my game is I medicate until I amputate. And that's what we have. So, the Neurontin, the gabapentin, the drugs that they're using for this, it'll mask the symptoms for a while, but it won't reverse it.
Wow, that's the difference between, I call the big box doctors and I call it the old school doctors, where they don't patch it. They look to focus on how to reverse it, or if
Absolutely.
not reversing it, keeping away from those meds
Exactly.
make it worse. I hate to say it. And again, I'm not here saying that all meds are bad, but
No, not at
stuff
all.
that I've seen, lately, it seems like it's getting worse, but that's a whole nother topic, which we could get in
Absolutely.
trouble talking about, and we won't. Anyways, guys, thank you so much, Dr. Rowe, for being here. We can find Dr. Rowe at annaneurodoc.com, annaneurodoc.com. And again, this show was on how to identify neuropathy early to lead the best treatment outcomes. And Dr. Cameron Rowe does have some great treatments on helping you. Make sure you guys call the phone number on the screen. Remember, guys, it's about helping one person at a time, helping them change their lives, because it's really, this life is about helping people.
Absolutely.
Once we get out of the way, everybody, instead of thinking, it's all about me, listen, we're all going to need help one day at a time. And if we can do it now, it's better doing it now. Anyways, have a great day, everyone. Thank you so much, Doctor.
Thank
And God
you. Thank
bless
you
you.
for having me.